Welcome back to the show. January is Cervical Health Awareness Month, the perfect time to remind all women of the importance of continuing routine exams despite the ongoing pandemic. Here with more on how cervical cancer can be prevented with regular screenings and the HPV vaccine is Dr. Abigail Zamorano, gynecological oncologist with UT Physicians. Welcome to you. Thanks so much for being here.
Yes, thank you so much for having me.
This is such an important conversation, and we should note, too, before we get into all the details, when we talk about cervical cancer, the symptoms can be really kind of vague, right? We think of maybe irregular bleeding, some pain, but virtually women can be symptom-free when they're going through this.
Absolutely. A lot of women with cervical cancer don't have any symptoms until they're in advanced stages. And so that's why cervical cancer screening is so important, so that we diagnose cervical precancer that can be treated so it never becomes cancer. But then we could also diagnose a cervical cancer in its relatively early stages.
And that's where those screenings come into play. So, of course, we're talking about a pap smear and getting those done once a year. Let's talk about family history. Is there a connection there? If women say, well, I don't have a history here, sort of like other cancers and things like that, should they be worried about this?
Absolutely. Cervical cancer is not one of the cancers that we typically think of as running in families. In fact, over 99% of cervical cancers are caused by the human papillomavirus, or HPV.
And so we also should note, too, the most common that you're seeing, sort of the age range here, is between 30 to 40.
It is. It really affects our younger populations, which is why it's so important for women who are relatively young and healthy to continue to see their OB-GYN or their primary care doctor for these routine screening exams so that, again, cervical cancer can be prevented.
Absolutely. It's all about prevention here. Let's talk about the screening. Of course, that is the pap test. And for most, that's about 21 years old is when a woman should begin that test.
Correct. It's recommended to start at age 21, and it's usually done about every 3 to 5 years. But that depends a little bit on your own personal medical history, your history of screening, and which screening tests you have. And for most women, it continues until age 65, but can really only stop if you've had regular screening. About 20% of cervical cancer is diagnosed in women over age 65, but that's mostly in women who didn't have regular screening beforehand.
Dr. Zamorano, you keep mentioning the screening, and I think this is a really great point to bring home, is that screening allows us to have sort of that baseline to see whether there's changes, and that's super important with something like cervical cancer, where you could maybe have something going on but have no symptoms.
Absolutely. Again, most women are asymptomatic. And again, because most cervical cancer or cervical precancer is caused by the human papillomavirus, that doesn't have any symptoms. And in fact, most people clear it on their own, meaning they never even knew that they had it. It's that lingering infection that can be picked up by a pap smear or a pap test that can help guide interventions to help prevent it ever becoming cancer.
Great information there. Let's talk about that HPV vaccine. Who needs it and why?
So it's recommended for both men and women, boys and girls, from age 9 to 45. And the benefit of getting the vaccine is especially seen before someone is ever exposed to HPV or the human papillomavirus, which is why it's so important in our pediatric populations. But again, if you're not a pediatric patient, and if you're into your, even later years, or up to age 45, you can still have some benefit from the HPV vaccine.
And even if you've been exposed to HPV, you still need the vaccine, right?
Yes, absolutely. The vaccine does prevent against 9 high-risk strains, and it's possible that even if you've been exposed, if you've had a positive HPV test at some point in your life, you might still gain, again, some benefit from the vaccine from those other high-risk strains.
Dr. Abigail Zamorano, thank you so much for joining us today from UT Physicians. Great information, and bottom line is get those screenings.
Yes, absolutely. Thank you so much.
Great to see you. Happy New Year. For more information, visit utphysicians.com or call 888-4UT-DOCS. That's 888-488-3627. We're going to switch gears now and toss it on over to Derek. Hey.
Thank you, Courtney.